Built in 1964 and officially opened for use in 1965, the only health facility serving Dodo Amanfrom and some 8 other adjoining communities stands on a vast landmass in the community centre. Portions of the land area the facility occupies, according to elders of the community, was earmarked for the establishment of a nurses' training and community health school, as well as a full-service hospital of district status as per the original plan. But these have not seen the light of day. Encroachers have taken advantage of a situation to erect residential structures on the land belonging to the health facility, a situation in Koswohini of the area. Nana Kojo laments.
In 1963, the government acquired land to build a hospital. The land was given to them. A health center was built. We were promised building, the government said, at that time it was Kwame Nkrumah's government. They said they would build a nurses training and a full hospital. The government acquired the land and the land was given to them. Now, it is only the health center which has been built. And the chiefs saw that the land should not be encroached. But presently, since there is nothing going on, people have encroached on the government land and we cannot do anything. So the authorities, the Ministry of Health, they should come in and either to build a health center or they stop the people from encroachment.
The huge health facility structure is being heavily underutilized and gradually wasting away. Town Development Committee and health workers fear the already worsening healthcare situation may get beyond precarious. Dennis Gakogo is the physician assistant at the Amanfrom Health Center.
You may say, well, why am I complaining about staff? Here is a health center and we have 14 staff. Then what's the complaint about? By natural fact, these 14 staff include the 2 ordering that we have, 1 security man, the supportive staff, but those we actually need for the work, for the bedside, taking care of the patient, I can confidently boast of 5 who are there to serve the clients within 24 hours. We have the C agents who are also about 5 in number.
The facility is being run by only 14 staff who attend to the health needs of the more than 5,000 inhabitants from Dodo Amanfrom and beyond. Dennis heads the team with 1 midwife, 4 critical bedside nurses and some community health nurses. Our checks revealed that the facility records about 60 cases on average daily, cases that are to be attended to by very few personnel. That notwithstanding, officials say the Dodo Amanfrom Health Center is bedeviled with a number of other pressing issues which require urgent attention.
One of the major challenges we have here is the lack of toilet facility. Actually, we have one down there at the outskirts of the facility, which when a client is having a running stomach problem, he has to rush to that place. And I think it's inconvenient.
The huge facility, which qualifies to be a full-blown hospital structure-wise, requires a facelift. Portions of the ceiling are falling off while the roof leaks badly when it rains. Other portions are in deplorable condition, leaving the 80-year-old structure exposed. We also discovered that the facility has been struggling with the unavailability of water to run the facility toilets, clean the place and wash soiled linens. According to officials, the water closet in the washroom and the sinks have been out of use for a long time due to the lack of running water at the facility, while others are broken down. We discovered some sinks had even fallen off, while others had simply broken down beyond repairs. The outpatients latrine on the premises of a facility was under lock and key, but officials say the latrine has been taken over by community folks who have virtually left the place unusable. According to the physician assistant, the issue is badly affecting the discharge of their clinical duties as a health center. He explains that patients are constantly sent back home if there is the need to use the washroom, after which they return to continue receiving attention to their ailments. He recalls there have been countless times where patients who presented with diarrhea went home every other minute to visit the toilet before returning for treatment. The health center is also hugely under-equipped. We discovered there were only 3 beds in the facility for use to detain patients who required medical observation. There were no drip stands, and a refrigerator to store vaccines at required temperatures had developed a fault. The facility has a laboratory which is not in use because of the unavailability of laboratory equipment for scans, x-rays, among others.
The lab here, the laboratory, is only the room that is there, but the equipment that we use it to operate in the lab, we don't have, so it is closed because the equipment that we'll be using, they are lacking. So that's why for the meantime it is under lock. We refer them to Papa say for the HB, scanning, X-ray, all those things.
Attending to late-night emergencies here have been hindered by poor lighting systems and the unavailability of a standby generator to provide illumination to the facility. It is Friday night at the health center, and this is what the premises looks like. Snakes and other reptiles frequent the facility, according to orderlies. During power outages, the Dodo Amanfrom Health Center is virtually left dark and empty. In instances where patients are detained during power cuts, they fear staying here and are therefore forced to go with their condition until the next day. It is almost 10 p.m. Friday, July 8, 2016, and there's total blackout in the entire community following the power outage. We dashed to the facility to check how personnel were coping, but to our surprise, it was deserted, total darkness, and no one in sight. Community folks say that this is what they've had to contend with all these years.
The health facility doesn't have a generating set to power the facility during power outages. So imagine a patient or a client walking in here this minute to seek health care. What will become of such a patient?
According to Ghana Health Service provisions, morning health staff are to work from 8 a.m. to 2 p.m., while the afternoon and night staff are to work from 2 p.m. to 8 p.m. and 8 p.m. to 8 a.m. respectively. However, the few health workers here find themselves working all day and all night. They have no off-duty periods. They also perform other extra tasks like accounting, national health insurance supervision, revenue collection, storeroom duties, dispensing, among others, due to the limited number of available personnel. Personnel say the presence of other staff such as a revenue, dispensary and accounting officer will drastically ease the burden off them and enable them to perform their duties well. Accommodation for staff is also inadequate. According to the PA, some new staff are being posted to the facility, but the unavailability of accommodation is delaying their arrival at the hugely understaffed health center. During our visit, we discovered that the only midwife at the huge maternity unit at the facility was on leave.
We are understaffed. The community is large, and we serve other communities around this place, but we are understaffed. So a way that maybe 3 or 4 nurses will do, one person will do it. So instead of us coming to work 8 and closing 4:30, we come to work at around 7, 7:30, and then we sometimes work at 6, 6:30.
Meanwhile, clinical records show the most prevalent cases reported averagely are severe malaria, asthma, diabetes, farm injuries, hypertension, unconsciousness, and casualties from motor accidents. The rest are snake bites, typhoid fever, diarrhea, hepatitis, among others. Officials say requisite equipment to attend to these cases are nearly always in short supply. All these challenges, according to the community heads, leads to long delays in receiving medical attention at the facility. Our investigations reveal the health facility is about to take off with a psychiatric unit in the coming months. However, the hope is that many more health workers will be posted to augment the already lean staff if the new unit is to fulfill its purpose. Unless this is done, the yet-to-be introduced psychiatric unit may just also waste away. A white elephant even before it is set up. Reporting from Dodo Amanfrom in the Kadjebi District of the Volta region, Komla, Adom and Appiah.